What I am about to tell you was never meant for the modern world. It was classified not by governments, but by time itself. A breathing ratio so precise, so efficient, that it rewired the cardiovascular systems of ancient warriors and turned fragile human biology into something frighteningly resilient. The 5.5 samurai breath is not relaxation. It is not meditation. It is a physiological weapon, hidden in plain sight, buried inside rituals that outsiders dismissed as superstition. And yes, it is dangerous if you do not understand it. Dangerous because once you feel what true cardiovascular efficiency actually is, you will never tolerate the weakness you are living with now. You were taught to breathe fast when stressed, deep when tired, randomly when afraid. That chaos is killing your heart quietly. The samurai understood something you were never taught. The heart does not want more oxygen, it wants rhythm. Perfect rhythm. And when that rhythm locks into the golden ratio of biological timing, the body enters a state modern science is only beginning to measure, let alone control. I am telling you this because the data now confirms what the warriors encoded in ritual. This ratio drops cardiac workload while increasing output. It sharpens perception while lowering blood pressure. It creates calm without sedation and power without strain. Ask yourself this: if a single breathing pattern can make your heart stronger by doing less work, why was it never taught to you? Why do hospitals treat symptoms instead of teaching rhythm? Why do elite performers stumble upon this accidentally, while the rest of the population suffocates under stress? This is not an accident. You are operating in a system that profits from dysregulation. The 5.5 samurai breath threatens that system because it gives control back to the individual at the most fundamental level, the beat-to-breath handshake between your lungs and your heart. Stay with me. Because once you see how precise this ratio is, you will realize you have been breathing against your own biology your entire life. Right now, whether you feel it or not, your cardiovascular system is operating in a compromised state. Not failing, not broken, but inefficient, noisy, and constantly overworked. Your heart is fighting your breath instead of being guided by it. Each inhale spikes pressure. Each exhale releases it too late or too early. The result is a subtle internal turbulence that modern life has normalized as stress, fatigue, or aging. But I want you to understand something clearly. This is not normal physiology. This is adaptive damage. Your heart rate jumps when it should glide. Your blood vessels stiffen when they should pulse. Your nervous system lives in a low-grade emergency mode, burning resources just to maintain baseline function. You may call it anxiety, poor endurance, brain fog, or poor sleep, but underneath all of it is the same hidden problem: incoherence. The samurai never allowed this state to persist, because incoherence on the battlefield meant death. A racing heart wastes oxygen. An erratic rhythm destroys fine motor control. A stressed vagus nerve collapses judgment. Today, the battlefield is different, but the biology has not changed. Deadlines, screens, noise, caffeine, fear-driven breathing patterns all push you further away from cardiovascular efficiency. And the cruel part is that you cannot feel the damage accumulating in real time. You only feel the exhaustion after. You only see the numbers change years later. Medicine waits until the system breaks. Warriors train to prevent the break entirely. This is the stake. If you do nothing, your heart will continue to work harder every year for less output, and you will call it normal life. If you learn this ratio, you reverse the relationship. The heart begins to trust the breath again. Pressure stabilizes. Rhythm returns. Efficiency replaces effort. This is not optimization for athletes only. This is baseline human function that has been stripped away by modern breathing habits. And once you see that your limitation is not lack of strength, lack of will, or lack of discipline, but a corrupted rhythm you never chose, you will understand why this protocol is not optional. It is corrective. It is restorative. To understand why the 5.5 samurai breath works, you must stop thinking of breathing as air movement and start seeing it as a command signal. Every breath you take sends instructions through pressure receptors in your chest, neck, and blood vessels. And those instructions tell your heart how hard to work, how fast to beat, and how flexible your arteries are allowed to be. Modern breathing scrambles those instructions. The samurai ratio does the opposite. At roughly 5.5 seconds in and 5.5 seconds out, something rare happens inside the body. The heart rate variability curve locks into its resonance frequency. This is not mysticism. This is physics applied to biology. Just like a blade vibrates most efficiently at a specific frequency, your cardiovascular system has a natural rhythm where output is maximized and strain is minimized. At this ratio, the vagus nerve becomes dominant, not weak or sleepy, but authoritative. It begins synchronizing heartbeats with breath cycles instead of reacting late. Baroreceptors in the carotid arteries and aorta start firing in harmony, smoothing blood pressure waves instead of letting them crash violently with each inhale. Nitric oxide release increases inside the nasal passages and lungs, subtly dilating blood vessels and improving oxygen delivery without forcing the heart to beat harder. Think of it as lubrication for circulation. On a neural level, this rhythm stabilizes brainstem signaling and pulls cortical activity out of chaotic beta into controlled alpha-theta overlap, the same state associated with heightened perception under calm control. This is why warriors describe time slowing down, not because the world changed, but because internal noise disappeared. The golden ratio metaphor exists because this timing sits at the intersection of efficiency and stability. Fast enough to maintain alertness, slow enough to eliminate turbulence. Too slow and you lose edge. Too fast and you lose coherence. 5.5 is the blade's balance point. This is not about oxygen saturation numbers alone. You can have full oxygen and still suffer if delivery is mistimed. The samurai breath fixes timing, and timing is everything in biology. Once the heart and lungs re-enter this handshake, the entire system stops wasting energy arguing with itself. Now we move from understanding to execution, because knowledge without protocol is just entertainment. The 5.5 samurai breath must be performed with precision, not approximation, or you will miss the resonance window entirely. Begin seated or standing with your spine vertical, not rigid, as if suspended from the crown of the skull. Your jaw is unclenched, tongue resting lightly on the roof of the mouth to complete the neural circuit between cranial nerves. You breathe through the nose only, because the nose is not a hole. It is a regulator. Inhale slowly for 5.5 seconds, not by lifting the chest, but by expanding the lower ribs, outward and backward, as if the breath is inflating a belt around your waist. The abdomen moves naturally, but the focus is lateral expansion, creating even pressure across the diaphragm. At the top of the inhale, there is no hold, no pause, no gripping. You transition immediately into the exhale, also 5.5 seconds, allowing the ribs to fall inward while maintaining length in the spine. The exhale is passive, but controlled, like lowering a blade into its sheath. Never collapsing, never forced. Your attention stays on smoothness, not volume. If you hear the breath, you are pushing too hard. Internally, you count without numbers, feeling the duration instead of measuring it, because counting disrupts rhythm. The eyes remain softly focused or closed, but the mind stays alert, not drifting. This is not relaxation. This is regulation. You continue this cycle for at least 10 minutes because the cardiovascular system does not respond to single breaths. It responds to sustained rhythm. If at any point you feel lightheaded, it means you are forcing depth instead of honoring timing. Reduce volume. Keep the ratio. The mistake most people make is trying to breathe better instead of breathing correctly. Precision matters more than intensity. This protocol was designed to be repeatable, under armor, under stress, under threat. Treat it with that level of seriousness. When executed correctly, you will feel a subtle pressure equalization in the chest and neck, a sign that coherence has begun. That is the gateway. The transformation from this protocol does not arrive as a dramatic explosion, and that is why most people miss it. It arrives as measurable efficiency. Within the first 2 to 3 minutes, your heart rate begins to drop, while stroke volume increases, meaning each beat does more work with less effort. Blood pressure starts smoothing out, not necessarily falling yet, but losing its sharp spikes. Within a single session, heart rate variability shifts toward coherence, something you can measure if you use the right tools, but more importantly, something you can feel as internal quiet without fatigue. After 3 to 5 days of daily practice, the baseline changes. Stress no longer hijacks your breath instantly. You recover faster after exertion. Your hands stay steady under pressure. Sleep onset improves because the nervous system remembers this rhythm and returns to it naturally at night. After 2 to 3 weeks, vascular responsiveness improves. The arteries relearn elasticity. Endurance increases not because muscles got stronger, but because oxygen delivery stopped being chaotic. Mental clarity sharpens, not in a manic way, but in a controlled, decisive way. This is when people describe feeling calm but dangerous, because emotional regulation improves without dulling edge. By 30 days, cardiovascular efficiency markers often show reduced resting heart rate, improved recovery scores, and lower perceived exertion during physical tasks. This is not adaptation through stress. This is adaptation through coherence. The samurai did not train longer to last longer. They trained smarter rhythms. Understand this clearly. If you practice this inconsistently, results remain shallow. Rhythm requires repetition to overwrite chaos. The timeline rewards discipline, not enthusiasm. If you commit to this protocol, your body will reorganize around it, because biology always chooses efficiency when it is shown how. Now you must understand when to use this breath and when not to, because this is where hidden knowledge becomes dangerous in the wrong hands. The 5.5 samurai breath is not for moments of panic when you are already hyperventilating wildly. It is for preventing that state from ever taking hold. You deploy it before stress, not after stress has consumed you. Before a confrontation. Before intense physical effort. Before entering environments that demand clarity under pressure. Practiced correctly, this rhythm becomes your default, and when stress arrives, the system resists collapse automatically. You can also use it after exertion to accelerate recovery, but never force it when your breath is still gasping. Wait until nasal breathing is possible, then reintroduce the ratio gently. Historically, this technique was restricted because untrained practitioners would chase depth, overinflate the lungs, and trigger dizziness or vagal overcorrection. That is not mastery. That is misuse. The warning is simple but absolute. Timing over volume, always. If you feel weakness, ringing, or dissociation, you have violated the ratio by forcing air instead of guiding rhythm. This breath also exposes internal instability. People with highly dysregulated nervous systems may feel uncomfortable at first because coherence removes the adrenaline mask they rely on to function. That discomfort is diagnostic, not harmful, but it demands respect. This is why ancient training systems layered this breath inside discipline, not self-help. It was never meant to be casual. Integrated daily, this rhythm reshapes how you walk, speak, and respond. Integrated recklessly, it becomes another tool misused by impatience. Remember this, the samurai breath does not make you powerful by adding energy. It makes you powerful by removing waste. And waste is what most modern systems are built on. Now the responsibility shifts to you, because knowledge like this only matters if it is embodied. I am not asking you to try this breath. I am challenging you to commit to it. 10 minutes, twice a day, for 30 days. Without improvisation, without modification, without chasing sensation. You will want to adjust it. You will want to make it deeper, slower, more dramatic. That impulse is exactly what this protocol is designed to discipline out of you. Mastery is obedience to rhythm. For the next month, you do not breathe when stress tells you to. You breathe when biology demands coherence. Track nothing except consistency. Let your body deliver the evidence. At some point during this process, you will notice that situations that used to spike your heart no longer do. Your voice will stay steady. Your vision will feel wider. Decisions will arrive faster because internal noise is gone. That is the moment most people quit, because the drama disappears. Do not quit there. That is where control begins. Understand the gravity of what you are carrying now. Most people will never regulate their cardiovascular system consciously. You can. This is not wellness. This is command over a system that determines how long you last and how clearly you act. Keep it quiet. Keep it precise. And remember this: the breath you practice daily becomes the breath you default to under pressure. Choose wisely.